Well, Robin Williams isn't the first celebrity to struggle with a mental illness. It's far too common. And no matter what your social background is, your job, or how much money you make, depression can affect all of us. Tonight we're joined by Dr. Brad Bayless from the Bayless Healthcare Group. Brad, thanks for coming in tonight. Now, I think the most heartbreaking thing about this is not only that Robin Williams is gone, but that he must have felt so hopeless that he decided to end his own life.
Well, I think that that's possibly true. All the facts are not in yet, but I think that he's had a long history of depression and some substance abuse, and I think that those factors played a significant role in his overall behavior.
We hear all the time how common depression is. How much of it do you see in your practice, and do you think that cases of depression in all the forms that it comes in, is it on the rise, or are we just better at diagnosing it now?
Well, according to some statistics that I recently read, about 39,000 to 40,000 people a year commit suicide. Approximately 1 million people attempt suicide. So it is a very common factor. Depression is a very common factor, and there's various types of depression. It can be a depression, which we refer to as dysthymia. There is also major depression, which is a very serious disorder and usually requires sometimes hospitalization and clearly some type of psychopharmacological intervention. However, I think that depression, and I think people should understand that depression is basically, by definition, anger turned inward onto self. And what people will do will sometimes get involved in self-destructive, damaging behavior that gets out of control.
Brad, we have 45 seconds left. I just want to ask you real quickly. I'm reminded of that picture of the clown in clown makeup crying.
Mm-hmm.
Is there any sort of a correlation in your mind between comedians who we've seen dealing with depression, and when they're on stage they're on, and then off stage they're in some deep depression?
Well, I think that oftentimes individuals who are major performers and who are always on cue may have difficult time turning it off. And at different times they may be suffering from depression, yet they are expected to be, happy, gregarious, outgoing, loving, and yet that's not really how they're feeling. And as a result of that, their secret life is sometimes different than what is projected outside.
All right, Dr. Brad Bayless from the Bayless Healthcare Group, thanks for coming in tonight and weighing in on this. And we just want to remind everyone that if you or someone that you know or love is having suicidal thoughts, if they're feeling that hopeless feeling, there's a place to go, and you should never be ashamed to reach out for help. It's 1-800-273-TALK. That's the National Suicide Prevention Line. Write it down.